which receives and disseminates information and sponsor activities for projects in the southeast corridor of Colorado Springs. And she also is on the Black and Latino Leadership Coalition president. What a resume, Yolanda. We're so happy to have you today. Thank you for being here.
Thank you, Lola, for that introduction. Now I have to live up to it. Thanks so much for inviting me. And wow, COVID, right? I think by now, I don't know about you, but I've known a couple of people that have passed from it, both elderly. But my niece, 26 years old, contracted it, got some, and she was 5 months pregnant and had some symptoms where she had to be quarantined for a good while. She's okay right now, but it is real. A lot of people think, oh, wow, it's not real. It's not happening. But it is real, and as you know, it affected our economy quite a bit. What the good news, though, is that our sales revenue for the moon is actually up from last year in June, is up almost 1%. And maybe that's the internet sales and stuff like that. But what suffered greatly is the lodgers, mobile, and rental tax. That was overall, we've lost 53% of revenue, and this last month we lost 64%. So we've taken a hard hit, and businesses, we've lost several of the businesses and have been struggling to get by. So there's so many different businesses, and I think that businesses that can be virtual anyway, and there are not too many people in the office, I think those have been less hit. But the businesses that require, like restaurants and the employees to go in, have taken. So COVID, we have been working, the city and the county, we've been working really close with the city and the county through our office management, emergency management. And we have a strong correlation with the public health department. I'm actually on the board of public health. But we have valued and been so impressed with the work of the public board. They have really done their research. They've gone out to sites. They've given recommendations, and we have taken those recommendations. For instance, they did transit to look over to see the bus riders and others have been hit, and some have died because and been exposed to COVID, and the bus riders. So there's been a mass effort, because on transit they gave off 5,000 masks, and people have been giving masks out everywhere, even at store, Home Depot, or you go to retail stores. If you don't have a mask, they will provide it. So one of the big things that I know that with public health, we're walking a fine. We want to encourage businesses to stay up and running and to flourish the best that they're able to. And that is by making the strong recommendations of doing social distancing, keeping up with the hand washing, and wearing those masks. And I know those masks can be uncomfortable, and when I first have them on for the first 15 minutes, I was like, oh, if I could take this thing off of me. But I noticed that once I get going, if I'm in a council meeting or I'm in a setting where there's other people, I kind of forget about it for a while. So it's so essential to go with the recommendations of the county health department, because that is where we're going to be able to keep our variances and be able to keep things running, because we don't want to go back. We're finally starting to trend where things are looking better, but I'm sure Dr. John talk about that real soon. So we're starting to look good. I thought, and I think those are the reasons that things have been working well. And so in terms of the city, we just opened a new testing site where you can test for free. and it's at the Citadel Mall, and it's from Tuesday through Saturday. So it's for people that think they might have been exposed to COVID. It's not like you have to have a doctor's note or anything like that. First responders to go, people that are in large areas. So that's super important. So with that, that's my spiel for right now, and I'll be happy to answer questions later.
Super. Well, thank you, Yolanda, for joining us today. I know I've got a couple questions more on rebound and see what kind of support is there for small businesses. I know there's been a lot of grants, and we could talk about that when we get to the Q&A. But you know, a lot of the smaller restaurant businesses and retail businesses have been suffering quite a bit, and their PPP is ready to exhaust itself. So hopefully you'll have some comments on that when we get back to the Q&A. So, and now let me introduce another remarkable woman, Dr. Robin Johnson. Dr. Robin Johnson is the medical director for the Department of Health for El Paso County. She's been there for 27 years, medical practice and healthcare advocacy in the Pikes Peak region. She practices emergency medicine at UC Memorial Hospital. She served as a deputy medical director for the Colorado Springs Fire Department, and she currently chairs the board of directors for Peak Vista Healthcare Centers, and has been volunteering leadership in a number of nonprofits over the years. Another stellar resume, and another remarkable woman who now I see on TV more often than some of the famous newscasters. Let's welcome Dr. Robin Johnson.
Thank you so much for that warm welcome. And as I was saying earlier, I don't actually watch myself on TV. That way I will still go in front of a camera. So I am really thrilled to be here and appreciate the opportunity to visit with you guys again. It is my privilege. And while I'm going to start with COVID numbers, but I want into some questions that have been raised and seem to be coming up. So while still elevated, COVID numbers in El Paso County have plateaued and are beginning a downward trend. And this is exactly what we have been wanting to see. And we're encouraged stay up and worry about what do all these trends mean, and how do we interpret them, and how do we get that information out. But there are several things that are occurring at the same time that they're at the forefront of a lot of our conversations. And while there's overlap in these questions, there's three that I wanted to just start off with to kick off this evening, and then we'll open it up to some more organic dialogue, because I think that you guys will direct what we need to address most advantageously. So first, the school year is upon us, and the question is, what do parents really need to be thinking about as they think to send their children back to school? And I really believe preparation here is key. Child checks, their vaccinations are up to date, you're thinking through routines for sleep and good nutrition to kind of maximize that sense of health and being invigorated, just a good foundation to start from. And next is the education with your child and the practice of good prevention. So really going through with them again the things that Yolanda was speaking about, that we all are layering on. These are the biggest tools we have in our toolbox to fight COVID. And what's really helpful is they fight almost all the other respiratory viruses as well. And we are moving into respiratory season. So good hand washing, covering your sneezes and coughs in your elbow, wearing a mask, and then creating a way for kids that wearing a mask is fun, and then increasing, kind of easing them into increased times with their mask. Also, I think it's important to talk about some conscious choices from your perspective about how you would cohort your family and who the cohort your family engages with to limit some probabilities of exposure. The third piece of that is, what is your plan if someone does become ill in your family? What's the backup and communication of expectations within your own family, the school, with your work, with what other outside help you may need? And you may need to be thinking through this with your primary care physician, thinking about testing, making sure that you know what would be needed if you were to stay home, so that you're ready and you know what the process and time commitments are going to look like in this kind of contingency plan. And then moving forward with best plans and recognize there may be a need to pivot. This is going to be a year of, and finally, staying abreast of data. Part of our flexibility is having some of that, the data that can really guide us. So assure that you're getting your data from reliable resources. Because this is a novel virus, while we have developed a foundation of understanding, there are still things we are learning. There are treatments and vaccines development, but there also is the data of what's happening in our community that we are going to need to be aware of. So the second question that kind of comes up from this, and I lightly touched on it, is its respiratory season is coming, and with the approach of fall comes flu season. So again, what do we do about that? And I think that continuing those preventive measures is key, because we are seeing in the Southern Hemisphere that the flu season, which precedes ours, is not as robust. A lot of thought that due to some of the prevention that we're doing for COVID, that it's not spreading as well. But to add to that, it's really important that we get up to date on vaccinations. And vaccinations are not just for children. Vaccinations are for adults, and we can all get our flu vaccine this year. And then for those of us who are 65 and older or have some other cardiovascular or pulmonary issues, we may be appropriate to get our pneumovax as well. And again, finding routine, prioritizing good balance and exercise, all of those things in preventive measures. So the seasonal flu and COVID are both contagious respiratory illnesses, but caused by different viruses. And their symptoms can overlap, so it can be hard to tell them apart. So they can share like fever, chills, cough, fatigue. But COVID-19 is more unique in a couple of their symptoms, being that change in or loss of taste and smell. And it is heralded as you get into about the first week, the end of that first week of symptoms, a lot of individuals will develop some difficulty in breathing. So for both flu and COVID, it's imperative that you wash your hands frequently. Again, all those preventive measures, but also additionally seek care early to have your clinician involved. Because if it is flu, there's appropriate use of antivirals that can be started that really can mitigate the severity and length of the course of your influenza. But if it's COVID, they can institute with you appropriate isolation and then contact tracing so that we can mitigate the spread. And then the last question that's been coming up that I just wanted to kick off with is, what do employers who employ parents need to think about as we enter respiratory season and school? And I think employers are probably the experts as they think through their business model. But as a clinician, I think about the flexibility and the preparation being at the center of plans for the coming year. Employers are going to really need to have open and transparent conversations with their staff about what options are available to their staff, what are remembering all of the things that are somewhat different. It's like traveling, I think I've said this before, it's like traveling in a foreign country where you don't quite know the language, so you're not quite sure that you're catching all the nuances you need to. And I think this COVID fatigue is real and fairly rampant. And keys for success in making it through this pandemic.
Go ahead, Joe. Your mic's off, Joe.
This is to Robin. Based on your expertise, what does this world look like let's say in the spring of next year?
So
Because
So
I'm hearing from Johns Hopkins University, if you believe what this expert says, that we will be wearing masks for years.
yeah, so what is really interesting is that, I mean, there are cultures that have been wearing masks for years, and so it has become the norm. I think that there's potential for this to be something that is required diligence longer than any of us necessarily anticipate. If we look back in history, our flu epidemic in 1918, lasted a couple of years. And so I wouldn't be surprised if we see that some of these preventive measures and diligence are really required for those couple of years. We don't typically, if we look at coronaviruses in general, we have not had any vaccinations for them. We don't develop long-term herd immunity to them, although we do develop some baseline that decreases some of the severity. And so I think that there's a lot to be learned. I think what we do have that now that we have never had in the past is our understanding of genomics and immunology in a whole new way. And we are making advances daily that if you had asked me at the beginning of my practice, I would never have anticipated. With the biologics with which we're able to treat cancer, to the fact that we would even contemplate having a vaccine within a year. So these are all, I think, very hopeful things that will help us speed up what has been in the past a fairly lengthy process. But there still are just some things that require time. I mean, we need to do the due diligence of our vaccine trials, whether that, starting in the lab and then moving into, animal and human trials to assure that we're assuming safety measures while we're looking for efficacy and some of those other things. So I know I'm not answering your question. I'm really trying to hedge because I haven't gotten my, crystal ball to answer me yet, other than to say, be patient.
Well, the reason I'm asking, there's odds in Las Vegas right now on what, how much we should bet on how long this will go for masks and that. So thought maybe I could get it from the expert.
Yeah, I'm afraid I wouldn't bet on that yet.
Okay. And just a follow-on question is, if when a vaccine becomes available, we know that there's going to be a portion of our population that won't take the vaccine. So
Yeah.
I don't see how we can eradicate this. And I don't see our society, and this is my opinion, going to continue to make that adjustment of social distancing and masks. We don't do it for the flu and we have a vaccine.
Yeah.
And I know this is more contagious than virus, but we don't do it for the flu during flu season because people don't always take the vaccine either. So
Well,
it's kind of a very challenging environment.
yes, it is. It is really challenging, and I think that taking on that challenge of finding ways to really build trust and to build communication that allows for a greater understanding of what those risk benefits are. I am a big believer in vaccine, and I think some of our pushback more recently against vaccines has been driven by some misinformation, which is much more easily accessible with social media and some of those new technologies. But also it's because we live in an era that our vaccines have been so effective that we haven't really seen the devastation of what infectious disease can do, such as measles or polio. And if those things, if they come back and we hear more about them, and the question will be if people are willing to learn from what happens in some other communities rather than having to have it as a personal experience to change their behavior. And we're seeing some struggles with that, obviously, but we continue to stay the course, and we'll continue to reach out to message. And I appreciate you joining us in hopefully putting that message out.
Great, thank you, Dr. Johnson. We have another question, this one to Yolanda from Debbie Swanson. Is the city offering any specific financial relief for businesses tied to COVID?
You know, the city and, you know, Colorado Springs has always been about the core services, right? Infrastructure, transit, parks and rec, public safety, public services. So the city has not done that, but they have partnered with the chamber and EDC. They are working closely with Impact Exponential that, you know, takes care of new businesses. Also with Pikes Peak Community Foundation and the county. So we are doing our best to support those organizations and partner with them. And also the county, I mean, they received $125 million in CARES funding. And it looks like they are looking to support small businesses with about $4.5 million right now. It's undetermined as it is, and they haven't given out those grants, but that's what they're looking at.
Great, thank you, Yolanda. We have another question for Dr. Johnson. This comes from Cara with Bank of Colorado. Dr. Johnson, can you explain why we will not develop a herd immunity for this type of virus?
So that is really interesting, and I don't know that we will not develop that herd immunity. I think historically our immunity to coronavirus has been shorter lived, and that is why we see the common cold, which is a coronavirus, recur. We're still trying to understand fully how much antibody, which is our markers that we've experienced the virus, are developed and how much immunity that they do infer. It really is a fairly complex interaction between virology and our own immunology. And the coronavirus is an RNA virus. It actually goes into your cell and hijacks its factory for making reproduction of protein to reproduce itself, and then it explodes out of that cell and goes spreading around. So when we see it, our immune system has to use T helper cells and all of these other little pieces of immunology to combat that. And so I think we're still really beginning to understand how we can help our immune systems to have that kind of like, this is the picture of the bad guy, so you need to respond upfront, right, before he enters. And there is movement being made on that, but we have yet to understand it fully.
Great. Now we have another message for Yolanda. Yolanda, how can the need for affordable childcare be addressed locally? I know that's a big one. And it says, especially with so many schools having virtual starts while parents were planning to get back to work. That's probably the biggest challenge, I would think.
Oh, yes. I didn't hear the first part of that question.
How can the need of affordable childcare be addressed locally?
Yikes.
That's a loaded question.
It is. I know, like here at work, half of the staff is working from home, and part of the reason is that they need to stay home with their kids right now, right? So a lot of parents are staying home with their their kids. Not only are they watching them all day long, they're schooling them, doing the homeschool. And that is a real challenge, but a lot of the parents aren't working right now. I know of a young lady who attends Colorado College, and it's her first year, and her parents are not working. And so she found, and she has siblings on top of that, and she's working at the local grocery store, King Soopers, to support the entire family. So there is, I honestly, the whole, and I think maybe the county plays into that with the human services division, that they have it. I think I need an answer from you guys about that. That is a lot. I don't know. I'll probably, after I get off, I'll like, oh, no.
I think it actually is truly a community problem and issue, and maybe putting together a task force to address it might be the best approach, and bringing in leaders from different organizations. In my opinion, that's sometimes how we tackle issues that we weren't expecting to deal with before.
Yeah, so this is, I'm going to jump in really quick because I think, Yolanda, yikes is the right response to that, because I think that's what everybody is thinking, is like, what do we do? And we, at Public Health have been impacted with staff staying home.
That's good.
Okay. Staff staying home to care for children, and I had an empty nest, and then suddenly I have 2 girls, a cat, a dog, and 3 chickens. So I understand, like, life gets turned upside down. I do think that, Public Health has been thinking through that. We think of the social determinants of health. So while we're dealing with the pandemic and physical health, we recognize that we can't have full health if we don't have a living income, if we don't have a roof over our head, and food security, and all of those, education, and childcare is a huge piece of that. So I think having a cross-sector, task force that looks at some of all of these various implications and brings together those voices to speak to how do we not only provide it, but maintain it, because our kiddos can be little petri dishes and bring all kinds of things to the care providers or home from a child care situation. I think it's going to be really imperative that we do that to create that sustainability.
That sounds right. And I just seen a comment from Sandy Lamb, who said Diane Price, President and CEO of Early Connections, would be a great resource to answer that question. It would be. She was a winner of Business Leader of the Year award just last year with the Women's Chamber at Accolades. So she'd definitely be good on that panel. But even so, maybe even Representative Terry Carver, who's on this call, would be another good add-on. Terry, do you have any comments on that?
Sure. I would be glad to reach out. Can you hear me?
Yeah, we can hear you.
Okay. We definitely have, at the state level, we have beefed up tax credits and other types of support for childcare that I would be glad to gather up information and share it however you would prefer to distribute that. And if there is perhaps a state level person that might be able to speak knowledgeably about that. Obviously, the state legislature is
really
out of
need
session
somebody.
until January, so we wouldn't be able to add any additional programs or money between now and next year that I'm aware of, unless there's some remaining federal money that can be utilized for that purpose, which I am not aware of. So if you'd like me to follow up on that, I'd be glad to do that.
Yeah, that'd be great, Terry. I think that's
Sure.
I think that's where it starts. It starts at the community level, and then working with our local representatives in the state, to be honest with you.
And that is a crucial question. I'm really glad that was asked, because food for thought. That's always an issue. It's been an issue, but now it's been exacerbated by COVID-19. So I was thinking one of the things is that how employers and small business can be flexible on what it looks like now to either bring children to work or have an area for children. But I think it would be great to have a task force and figure this out.
Yep, I agree. So good conversation. There's another question from Vicki Drew from the Bank of Colorado for Dr. Johnson. Are you seeing anyone with the natural immunity to COVID-19 since it's had such a major impact on older citizens?
Yeah, so natural immunity, it's a really interesting question because this was asked with like the spread of smallpox in the Native American populations when there were first European immigrants, and they have very less diverse HLA-B haplotypes within their immune system, so they didn't necessarily develop as much immunity as was developed in some of the European areas where there had some more diversity because of migration and other things. So that's a really legitimate question. I don't know that we have been able to tag natural immunity because we're still asking the question about having developed immunity, having seen the virus, right? And what our immune system does to actually develop antibodies that recognize, fight the infection before it ever finds a foothold. As far as it being more devastating to our older populations, there are several theories to that, and it has to do with some of our ACE receptors on the endothelium, which I probably sound like I'm talking a foreign language, but there are certain receptors on all of the cells that line our vessels. And so while the virus enters in through our lungs, it tends to affect the lining of our blood vessels, our heart, and some of those things. And as we age, or men more so than women, tend to have some more of those receptors, and they seem to be affected. Exactly why is still to be fully understood. But we also know that those who have cardiovascular disease, diabetes, obesity, are also more at risk, even in some of the younger ages, but particularly as they age. So those are really good questions that we are relying on our scientists and clinicians, researchers to help investigate.
Great. Another question for you, Dr. Johnson, from Joe Eldez from the Hispanic Concilio. What's your expert recommendation for kids returning to school?
Okay, that one is politically fraught.
Yeah.
So I'm just going to go right with Yolanda to yikes. So no, what I would say to that is that, you know what, this is a community decision that we will need to make with the data in mind and the needs of our community. It is around our physical health, but we have to take into account just even the questions that were just being discussed around childcare and the ability for parents to get back to employment. But there's also really significant questions that need to be addressed in childhood development. And we learn, particularly in our younger population, by watching and by that social interaction and interacting with peers and learning from other individuals hands-on. And so not only are we talking about our intellectual development, but the psychosocial development of our children. And before COVID came on, I was on the bandwagon about minimizing our social media as we move into adolescence, because of it really can hijack the development of our frontal lobes and its connectedness to the rest of our development. And so it's true for while our adolescents can really thrive with online learning because they're gurus at this. And there's a lot of platforms from which we can work. And I'm not saying we shouldn't go that route, but we've got to find that balance of really learning social interaction, learning to read other people's emotions, learning how to interact in a social manner with civil discourse. And so those are really pertinent things to bring into that equation and bring the experts together from the schools, from public health, from the business sector, from our elected leadership and others to really make these decisions as a community.
Great.
I wanted to add on to that. I'm on the Board of Public Health, and in our last meeting that we had at Centennial Hall, there were a lot of teachers there. Teachers expressing their fear about going back and feeling like they had to go back or either turn in the resignation. Very afraid of being, of getting COVID and not knowing how to distance the kids. And I could see the kids need that socialization. And also, if we were just talking about childcare, I think a lot of the parents do rely that their kids are going to be in school during that time. So that is such a tough one. And I know on the school board D11, they are really struggling. And between the school board members, they cannot come to a consensus. I know that they're going to open up in phases, but that's also a tough one because we're gathering in a lot of people in a small amount of space.
And indoors.
I think a larger concern is the underserved, underrepresented communities and those children that are from single parents and those that are low income that rely on nutrition and all of that at the schools. There's going to be a lot of unintended consequences. And this is my opinion. If we don't find a hybrid model where kids can be in school, because we're in a unique environment, but I think we don't even know the unintended consequences for those kids that don't have some of the advantages of other kids in the community. That's my concern with our low income population, some of our minorities that are facing those challenges right now, where they see the school has a resource for them and for their kids.
Joe, that is a true concern, and I bet Yolanda has information on that as well. But we track some of that, at El Paso County Public Health as we look at equity and what that means for our community and how do we recognize those gaps and shore them up. We do recognize that there are significant needs, not only what we have spoken to already, but in that social arena as well of, the roof over your head and nutrition, and then also just as a stress reliever for some of these families that we know that our schools are many times a warning signal for the safety of our children too.
It seems to be on this call very much so the children and daycare and early childhood is such a big topic because it's truly being impacted in so many different ways. Linda Meredith said that Kelly with Alliance for Kids and Early Childhood Council in El Paso County would be able to speak on early childhood. I think truly, again, it's bringing back a committee in the community surrounded around these issues and these challenges and coming up with solutions, especially the people who are leading some of this at the forefront and seeing the impact directly with the children and early childhood as well.
Lola, could I add just a comment or two with regards to the challenges with schools reopening and how to do that?
Sure, go ahead, Terry.
I've got 5 school districts that overlap with my house district. And, obviously each school district is coming forth with their own plan. but I have heard from, I would say at this point, hundreds of parents and many teachers. Um, uh, Parents, and we're all have this kind of bifurcated concern, right? That yes, the concern is how much additional risk is there to in classroom, but the parents, while expressing concern for those safety issues, and especially if they've got a family member with fragile health, also have said almost to a person, and a lot of these are, in-person discussions I've had with them or on the phone, that um, for the most part, they said, of my 3 children, just to give you an example, um, my 10-year-old girl did fine doing remote learning in March, April, and May. My 2 sons, basically, that time was completely lost. So the learning that they had at the end of the school year in spring was almost entirely eliminated for my sons because they do not do well in remote learning. And our daughter did fine, but our sons needed that classroom interaction, that ability to talk with teachers and be part of that classroom dynamic. And they said, thank God the school district decided that whatever their grades were in March would be their grade in that class, because they said otherwise our sons were going to fail just based upon they didn't understand the assignments, they couldn't do math, we weren't sufficiently able to assist them. And so they said, we really feel like without some hybrid at least of our kids being able to be in class and engaging with their teacher in that kind of environment, that they are going to fall further and further behind in educational achievement. And I have heard that from so many parents. So now I heard the same thing from teachers. And Yolanda's absolutely right. A lot of concern and worry about the safety, but in almost the same breath, they say, but we also know how important it is for children in their educational achievement to have in classroom learning. So I just thought I would pass that along, and I think that's, those are the dynamics that all the school districts are struggling with.
Yes, that is true. I think they're really confused. My sister happens to be a teacher in school district 49, and they're going through the motions, and it's this way one day, this way the other day, constant changing, and it's very stressful. I've seen it on her, how stressful she is, not knowing what things are going to be like, how things are going to be. Well, definitely great conversation on all of this. I do think community leaders should come together, especially on this childcare and schooling and homeschooling, because it does put more stress on the parents if they have to work from home and then be that school teacher from home as well. It's definitely overwhelming for them. I have a final question, I think, for Yolanda, and I really like to get a sense of how are our businesses, our retail business and restaurants doing right now. I'm really concerned that we haven't seen, in my opinion, the real downside of the economic impact here as they run out of PPP and they're only operating at less than 50% capacity, and they're working and their operations are on minimal margins, that they can't survive that much longer in this type of environment. Any comments from you on that, Yolanda?
That is so true, Lola. They, like I said earlier, the small business retail, they are taking a hit. Some of the restaurants have closed down. And like Richard Scorman, as you all know him, he's put a pause on his restaurant, and he's not going to go back until October. He's going to try it out. but he was hemorrhaging money. I mean, that's his livelihood for retirement. And so he took a pause on that, but they kept the store, the bookstore and the child store open, the toy store, and they're doing online. They're hoping that people will go to independent areas and order, but retail is suffering immensely, and then there's this resistance, right, to using the appropriate protocol toward using masks, and um, there there's more. I think there's more resistance here, like in El Paso County, and where we're able to at least support the businesses, so that the chamber came here and really wanted to encourage people. This is before the mandate. It was just a week before the governor did the mask mandate. But it's like we all have to work together. But businesses were getting in, they were asking people to wear masks, and the people would get really upset. So I think there just has to be a lot of education that goes on to make sure that our retail centers and our small businesses stay open, but definitely taking a hit because in Southeast, part of the programs from Transforming Safety are the Thrive, which was a recipient of Transforming Safety funds. And so just to tell you really quick is like, Transforming Safety, we got $2 million a year for 3 years, and we got another 3 years. Well, that was supporting small businesses to start up, and they, whether directly or indirectly through Thrive and other organizations, through the Solid Rock Inc. And now, one of the recent graduates, like Julie Ramirez, she had all set up to have her coffee shop and in Southeast there at Mission Trace, and she hasn't been able to start it. And I was part of the distribution for the grants for Transforming Safety, and we had to cut $1 million. So many people that are organizations and small nonprofits and business would have had that opportunity. We had to completely cut that out, $1 million. It was heartbreaking. So, that's why we're going into a recession. It's going to be a long time for us to come out of that. And so one of the things the mayor is doing, because the Tabor and the ratchet down effect, like he's asked us to put on the ballot to have our revenue matched to 2019, because we were doing well. Because if we match it to 2020, when our economy's gone, it's gone down, and we were slashing the budgets here. I mean, they're doing it at the state, they're doing it at every level. So our budget's also being slashed. So he's going to put this ballot measure on, and is asking us so that we do not have to end up suffering like we did in the recession and take 5, 6, 7 years to recover. And hopefully the people will vote for it, and we will not have to deal with that ratchet down effect until 2022. And hopefully we will have recovered more. So in a macro sense, that's what we're doing here in the city. The city council is really supportive of the mayor's initiative to make that happen. And also we're always asking for the Tabor refund so that we can use that money because of our budget being cut, and that money is going to go toward public safety. But yes, we're taking a hit. The businesses are taking a hit, and all I can say is that I know earlier Senator Bennett used to have a lot of town halls on making sure that the small businesses were looked at. I mean, I remember he directly worked with Southeast small businesses, people with color, and women. And, I was on the call too with the governor and Senator Bennett, and there were mostly men on these calls. There were very few women on this call. There might have been 2 out of 10 or 12 men. And so that I don't know how well we are at making sure that women and small businesses make sure that they access every grant or every avenue possible that's there.
Yeah, that's truly important, Yolanda. And to add to that, I do want to share, as everybody knows, El Paso County has the Business Relief Fund that was spoken about earlier. That just went public to the community, grants up to $20,000 for small businesses and small nonprofits, 501c3s. There is another grant that I want everybody to know about on this call. It comes from Energize Colorado. If you're not familiar with that, that just got unveiled here too. Energize Colorado is doing a grant, and this one is specifically for minority, women-owned businesses, veteran-owned businesses in rural markets. So I would check out Energize Colorado. The grant amounts there are up to a maximum of $15,000, and that is being head by the former CEO of DaVita. And I think Energize Colorado has collected well over, I don't know how many millions of dollars, I don't know if it was 70 million, that they're pulling together for the whole state of Colorado and putting these grants together. I do know that our board chair, Barbara Myrick, is sitting on the committee, the oversight committee for that grant process. So right now, I know of a lot of our businesses, as Yolanda mentioned, are struggling. And indeed, we serve, the Women's Chamber serves small businesses. 70% of our membership is small business. So we feel it as well. We've lost significant amount of revenue because as a chamber, we do events. And when you're shut down from, and I'm not saying not doing events, we've actually pivoted to a hybrid mode, but the capacity, when I used to fill a room of 150 people on a first Friday, I can only put 40 people or 27 people. It's a big impact. But with that said, I want to thank both Yolanda and Dr. Johnson for being with us today. And thank you for sharing all of this information. I think there's been really great dialogue. If you have any more questions or whatnot, feel free to chat it in the chat box. I will continue as I usually do, stay on the call for the next 30 minutes for any members or business people who are on this call to answer questions. We're doing our part as a chamber. We provided, I know what you're saying about the masks, Dr. Johnson and Yolanda. It's not quite the Wild West. I think Woodland Park's being challenged a little bit more with the mask wearing up there from my colleague Debbie. But I could tell you that we put buttons together for our members and for the business community that say thank you for wearing your mask, because we're trying to protect all the business.
Oh, my pleasure. Oh, you're welcome.
So it's great that we do those kinds of things, and it's the protection so that we don't have to pull back variances anymore, so that the businesses can continue to thrive, and that's really important. So I will stay on the call. I will just make a final pitch for accolades this year. It's going to be very different. I hope you all attend. I'm sorry we're sold out in person right now because we can only max so many, but we are selling virtual tickets and we are selling them by bulk for those organizations that want it. This accolades is going to be very different. We felt that it wasn't a time to select or pick one or two business leaders or winners for accolades this year. It wasn't capturing the magnitude of resilience and innovation in our community. So we decided to go back to how accolades was formed. And from a French verb, accolades means to embrace. So this year will be the embracing of our businesses, our members in the business community. It will be a very inspirational event. We have a top international speaker. We are planned for hybrid mode, and it will not be on Zoom. It will be production-like, kind of like a Netflix per se, and we're really excited about it. We will also feature businesses and do some B-roll of businesses who actually adapted and pivoted during this time in our community. So it's going to be a really exciting time to learn best practices as we don't go back what used to be. We move forward in this new world that we live in. And I think it's important for us as a chamber and organization to lead on how we live with this current pandemic and be able to adapt and pivot during this time frame and be nimble and be respectful and patient during this time frame.
Thank you, Lillian. It's been a pleasure. Thank you for having me on. And I've signed up to be on virtually at the
Great.
accolades. And I love your theme and how to embrace. That's wonderful. So I'm looking forward to that. This was a very sober conversation that needs to be had. But like you said, we'll move forward together.
Yes, we will. We will. Dr. Johnson, any parting words?
Yeah, thank you. Thank you again for the opportunity to come. I'm always, I think, inspired by the questions to dig deeper and to know more. And just by, I think, the quality of the individuals I get to interact with. And for me, this has been one of the silver linings of our pandemic, if there are, is the opportunity to really meet and see our leaders in the community in so many different sectors that are leading the change and driving innovation so that we can thrive through such a time as this. So I want to thank you all for the work that you do, for the opportunity to interact and collaborate with you. And I welcome any opportunity to continue to, integrate our expertise together to make a difference as we move forward.
Well, thank you, Doctor. I will tell you, I am very, very impressed with El Paso County in this whole realm of the pandemic. Just being on top of things and being responsive quickly, all of that. It's been a pleasure. I'm not a big proponent of major government control of stuff, but I will tell you, you guys have done a phenomenal job of taking out all the red tape of things and getting down to the nuts and bolts.
Yeah, I think our real mission is that we are here to really protect and serve the public. And it isn't about taking control, but rather to get the right information at the right time so people can make really the right decisions because they're informed and have a foundation from which to make those decisions from. And I put it in the chat box, but if you would send me information on accolades, I would love to, sign up and get to see that in action. I think that would be really fun.
That'd be great. We'll definitely do that. I'll either have Debbie or Julie send you that information. We'd love to have you join us.
Thank you.
Great. All right, folks. Well, that ends our session for today. Our next town hall will be September 10th. Mark it down on your calendars. I also want to do a final shout out to our sponsor, Lytle Electric. When you think light, think Lytle.